All right. Is that working on your end?
Yes.
Okay, great.
Welcome, everyone. We're just about a minute away from noon, so we're going to wait 1 or 2 more minutes, and then we'll go ahead with introductions and get started with the webinar.
Oh, what are you two down?
All right, well, welcome everyone. I have noon on my watch here, East Coast time. So we'll go ahead and get started. My name is Lisa Lunghofer, and I'm the Executive Director of the Gray Muzzle Organization. I'm joined by my colleague, Amanda Grant. Thank you all for listening in today. I hope you're all hanging in there during what we all know is a really challenging time. I also hope that the next hour will provide you with some helpful mental diversion and some really useful information. We are thrilled to have Dr. Tamara Shearer presenting today. She's a graduate of Ohio State University College of Veterinary Medicine, and she helped develop the International Animal Hospice and Palliative Care Certification Program that provides over 100 hours of continuing education on hospice and palliative care. She's also one of only 30 veterinarians to receive a master's degree in traditional Chinese veterinary medicine. She's the practice owner of Shearer Pet Health Services and Smoky Mountain Integrative Veterinary Clinic, where she focuses on rehabilitation, pain management, hospice care, and traditional Chinese veterinary medicine for her patients. She's won numerous awards and authored and edited several books, been featured in national media, and served as president for several veterinary associations. So we're really delighted to have her here today with us, sharing her expertise. Before I turn the floor over, I just want to point out that you should see a Q&A box on your screen into which you can enter questions. So we'll have time for discussion at the end of the presentation, and we'll do our best to get all of your questions answered. With that, please join me in welcoming Dr. Shearer.
Well, thank you, Lisa. Thank you, Amanda. And I really have to give a lot of thanks to the Gray Muzzle Association for inviting me to do this webinar. And I'm looking forward to sharing with everyone some tips. It was a real challenge to try to take and put information in just 45 minutes, because I feel like there's so much that needs to be shared. So hopefully you'll find some useful tips, and I'm going to go ahead and get started. And like Lisa had mentioned, we'll just save our questions for the end. If we don't have time to get to all the questions, then most definitely we can correspond by email and make sure that everything gets covered to fit your needs. But I want to start off with, oops, let's see here if I can get this to move forward. Uh-oh. All right, Amanda, I can't get my slides to move forward.
If you're clicking, it's not just going?
No.
You would have to mess with it on your screen.
All right.
I don't think I have any control over it.
Okay. Let's see here. I'm not sure. I'm sorry, everybody.
Oh, that's okay. Technical.
There we
technical
go.
problem. There you go.
We're good. We're good.
Problem solved.
Yep. Thank goodness. I was going to have to figure out how to remember everything in my slides. So the first thing I want to talk about is a little bit of incidence in our dog population, and it is definitely different than what we see in cats. We know that 1 in 4 dogs will develop cancer sometime in their lifetime. And that doesn't necessarily mean that it's just in older dogs. And I'll talk about some examples as we go on. But 50% of the dogs over 10 will develop some form of cancer. Of course, this is always affected by the animal's breed and actually sometimes the size and even the sex of the animal, depending on what we might see. There was a really, really interesting study done in Georgia, and this is a study that was done back in 2011, and it's worth mentioning because they studied 75,000 dogs from 27 veterinary hospitals, and they studied 82 breeds, and they actually had a mixed breed category too. They were looking at the cause of death, and they wanted to see, you know, about age and the dog's breed and how it might also associate with the dog's size. And what they found I thought was really fascinating, and that is that cancer did peak in the 10-year-old age group, but then it started to decline in the oldest age group. So then we think that dogs in that older age group may actually die from other complications like maybe kidney disease. So anyhow, very interesting study and a very reliable one because it included over 75,000 dogs. But we often think of the different signs of cancer, of 10 major signs, but I went ahead and I added one. I added behavior changes and seizures, because we're going to talk a little bit later about why that's important to use that as an early indicator of certain kinds of cancer too. But what I thought I would do throughout the presentation is go through these different findings and just kind of share some tips that might help you in early identifying cancer in your dogs or your pets. And then at the end of the presentation, what I'm going to do is talk about some ways to treat cancer, some ways to palliate cancer. But I thought what we'd start with is kind of the obvious. And sometimes the not so obvious. You know, there are actually some additional clinical signs that associated with cancer, and it's got a fancy name. It's called paraneoplastic syndrome. So there are different syndromes that we see when a pet has cancer, and one of them is pretty obvious. You know, we think about weight loss and just not looking like they're thriving. But also we can see hypercalcemia, and that's where the calcium goes high. And this is kind of interesting because sometimes we'll pick that up on a blood test before there might even be signs of cancer. So again, it could be an early warning sign that there's cancer. Of course, it could be caused by other things too. Sometimes we have ulcerations associated with certain kinds of cancers. We could see ulcers in the stomach or throughout the bowels. Another type of clinical sign associated with cancer would be hemorrhages. We can have bleeding disorders associated with certain types of cancers. Also, low blood sugar. So if we have a tumor in the pancreas, sometimes we can develop a tumor called an insulinoma, and that can cause the blood sugar to be low. And also, we can have irregular bone formation. And that could also be considered what we call, again, a paraneoplastic syndrome or a clinical sign associated with the cancer that isn't the cancer itself. It's a consequence of the cancer. So again, that's something to kind of keep in the back of your mind. But then moving on to the most obvious, you know, we talk about one of the signs of cancer being swellings or sores that might not heal. And sometimes we can be confused by what we see. This is just an example here on the slide where if you see this paw pad, it looks like maybe there's an abrasion there, or maybe you know, some kind of trauma, a cut. And this is actually a form of cancer. So again, if we have a sore that doesn't heal, or doesn't behave like what we're used to seeing, we want to kind of keep that in mind. And we're going to talk about how to do an at-home exam for cancer. And I'm going to bring this up here because I want to make sure that everybody remembers to check the dog's feet. So you want to check between the toes, you want to check the nail beds, you want to look at the pad like what we're looking at here in this photograph. So important, because there can be things there that pop up that would easily be missed because it's not a real obvious place to look. And also the dogs that have the really hairy feet might be hard to see. So make sure you part that hair and look. But again, this is an example of a type of lymphoma that might be mistaken for something else. Now this slide here, again, is something that you might think could be, you know, maybe a bruise or maybe some trauma on the skin. And this is actually an example of what we call a cutaneous hemangiosarcoma. And that is a malignancy. And you see on the sheath on the patient on the right there, that looks like a pretty big bruise, but it doesn't necessarily have to be big. It could actually be very small. So anytime we have something that looks different, we want to pay attention to it. And again, this would be something that's going to persist and it's not going to go away. And we would consider it, you know, a swelling or a sore on the skin. Now, these three photographs are actually pictures of examples of mast cell tumors. And you can see by looking at all three of these that they're different in different locations on the body too. So one of the important things that we will talk about is how do we make a diagnosis here? We can't just make a diagnosis by looking at these three because they're all different. And again, we might assume that the one on the far right doesn't look very angry, but it is indeed a mast cell tumor. So until we check a lump or bump with what we call an aspirate, sometimes we're only guessing at what it might be. And there's been so many times that I've checked a patient and I've actually been wrong. I will think it's something and it turns out to be actually something else. We have soft lumps and bumps, and you can see here on this patient, there's a little really soft bump just above where the arrow is pointing. And again, that turned out to be what we call a fatty tumor or a lipoma on this patient. Actually, mast cell tumors can also feel like soft bumps. So again, it's important that we check every lump and bump that we identify on our pets, and make sure that in between your veterinary visits that you do a monthly home check to make sure that something doesn't pop up in between your visits. So here's a little lump and bump guideline. What I did is I put red dots on areas of where our dog's lymph nodes are located. So if we look at the picture to the right, the ones up underneath the jaw there, those are the mandibular lymph nodes. The ones under the legs are axillary lymph nodes. The ones down in the groin are inguinal lymph nodes, and the ones behind the knees are actually popliteal lymph nodes. So those would be the locations that you might want to check. Again, I would recommend on a monthly basis on the older dogs and even on the younger dogs too, to make sure that you don't feel any swellings. Because change in those lymph nodes, again, we have a swelling that doesn't belong there, might be an early indicator of cancer. And of course, the earlier we find something, the better the outcome is always, and the more educated we can become about things. And again, until we can prove that something is benign and not something that would be life-threatening or life-limiting, again, we have to have some way to check that. So the next thing I want to talk about is weight loss and loss of appetite. And those are kind of obvious problems that seem logical to make note of. What we have to watch is, you know, do we have a patient who's losing weight, but maybe they haven't lost their appetite? So again, if we're not trying to lose weight, then you have a spontaneous weight loss, that would certainly be something that would catch my attention and would be a warning sign. So again, we want to watch that. Again, sometimes when we're around our pets all the time, we might not notice subtle changes. So it's important to make sure that you weigh your pet on a regular basis. Of course, the rule of thumb, and this doesn't really have anything to do with cancer, but the rule of thumb for a good body condition score would be when you touch your dog's sides, you should be able to feel their ribs, but not be able to see their ribs. And also when you look down on their bodies, you should be able to see a waistline. So again, if you notice changes where all of a sudden you're starting to see some bony prominences like the spine or the ribs start to show, we want to pay attention to that as a possible warning sign of cancer. Talk about another sign of cancer being bleeding, discharge, or odor. And we want to make sure that we know where to look for things and where those common odors might come from. Just aside, one of my hobbies is I like to collect antique photographs, and I'm not so sure what this group of dentists is doing with this dog, but it's an old photograph from the early 1900s. And I just included that because a lot of times odor will come from the mouth, and that could be a warning sign that we have a cancerous process going on there. I'll show you some slides at the end of this presentation that will kind of show you some things to watch for. We also, if we have some unusual odor coming from the ears, and that might not necessarily mean that we have an ear infection, but it might mean that we have a growth down in the ear canal that maybe we can't see. We could have a polyp down there, but again, you might not always think about having a tumor in the ear canal, but it can happen. And again, odor might be the first thing that you notice. Of course, you might also notice that that dog or even that kitty would be uncomfortable, maybe shaking its head, or if the pet had chronic ear infections, again, it would be something that I would want to make sure there's not something down there that doesn't belong. As far as the mouth, I think personally, when I see a patient that has some kind of oral cancer, the odor that I smell coming from the mouth is actually, I think, a little different than what we just smell with your typical bad breath. There is actually a more of a foulness or a putrid smell to it. Not always, but often. So again, if you notice a change in your dog's bad breath, then again, you may want to seek additional care. Of course, if you have an odor coming from any place else, you know, an anal gland, so at the back end of the dog, again, we could have, you know, maybe the start of some problems back there too. So again, odor is one of those signs that we worry about as far as a sign of possible cancer. So bleeding or discharge, again, it's on our warning sign list, and common sites for bleeding or discharge might come from the nose. If we have bleeding coming from the mouth, that could be a sign that there could be a tumor there. Bleeding, definitely blood coming from the rectum. We always want to rule out that there's not a polyp or not a tumor that could be causing the blood come from the rectum. If we have blood in the urine or blood coming from the urinary tract at the vulva on the female dogs or at the tip of the penis for the male dogs, again, we might want to consider that that could be an origin of cancer from the bladder or from the kidneys. And again, if we have bleeding or discharge coming from the ears. The patient that you see over here on the left, her name was Dolly. And I saw her, I think I have another slide here of her. Yes, she was 13 years old when I first saw her, and she presented to our hospital because she was having nosebleeds. And the doctors that saw Dolly before she came to me actually had ruled out fungal infections and had ruled out bacterial infections, so she just wasn't doing well. So we were really worried that she had a tumor up in her sinuses. Unfortunately, you know, under the circumstances, we didn't do any additional, you know, imaging or diagnostics. So what we ended up doing was palliating her. And some of the medications that we used, and we'll talk about this a little bit later, we used a little bit of prednisone to help her with pain and inflammation. I used 3 herbal formulas that we'll talk about later. One's called Stasis Breaker, and that is to help support patients that have cancer and help slow the progression of certain cancers. Weiqi Booster helped Dolly with her immune system. And then Yunnan Biao is a really, really important herbal formula. It actually helps with bleeding. And so these were the different things that we used to help manage her condition. We also used a nose drop to help with any active nosebleeds, and we combined a little bit of epinephrine with the Yunnan Biao. And we had the family use that with Dolly if she had a bad nosebleed. But one of the first times when I met her, she had such a bad nosebleed. I'd never seen so much blood come from a dog before. And that's saying a lot. So she was very lucky in that by using this protocol, we were able to maintain a good quality of life for a year, almost 2 years, a year and actually 10 months. She did well. So one thing that can help with nosebleeds, no matter what the cause of the nosebleed, whether it's cancer or we have infection, is actually Afrin nose drops. It's not a bad thing to have in a first aid kit. And there was an interesting trial done on people where they used different things to stop nose drops. And they found that the oxymetazoline was actually more effective than using epinephrine and lidocaine and also cocaine in a study. So again, I started using the Afrin drops for patients that do have nosebleeds, and it is safe to use. The other thing that's really helpful to know, and this would, you know, be for any kind of bleeding, there's actually an acupoint located along the middle of the back. It's called TIAN-PING, and it's a classical acupoint to stop bleeding. And it's located between where the thoracic vertebra end and the lumbar vertebra begin. And the way you could find that place is if you can feel on your dog's back. It's the first vertebrae space that you come to after the ribs end. So you can kind of see on this slide here about where that would be located. But actually applying pressure to that area could stop, help stop bleeding. So again, kind of keep that in the back of your mind for any type of hemorrhage. Yunnan Biao is a herbal formula used for bleeding. Its active ingredient is called Noda ginseng or Tian Chi. And again, it's used in other forms of cancer besides just nosebleeds to help with hemorrhage. It's often prescribed for dogs that have a cancer type called hemangiosarcoma that's prone to bleeding. Very safe herbal formula. And there's actually a little emergency red pill hidden in the package. So when you have an acute crisis, that's what you reach for first. So again, if any of you have a first aid kit for your dogs, that would be a good thing to add. So again, Yunnan Biao can be really helpful no matter what kind of bleeding you have, whether it's bleeding coming from the bladder, whether it's bleeding coming from the mouth or the nose, or even, you know, a laceration not associated with any kind of cancer. We also want to look at a loss of stamina and lameness as a sign of cancer. And, you know, I think what's interesting is most folks don't think about lameness as being a sign of cancer, but we do worry about that. And I'll talk a little bit more about that in a little bit. But I do want to talk first about loss of stamina. So a patient who has cancer could have the clinical sign of loss of stamina. And that could range from just a mild, mild lethargy to profound tiredness. This is Mocha. Mocha had 2 different kinds of cancer. She had osteosarcoma, and she also had some primary lesions in her lungs that were not metastatic lesions, she went to the University of Tennessee and had her definitive diagnosis. But when you have cancer or have a chronic disease, it's not unusual to also struggle with anemia. So again, one of the first signs that you might notice with a pet, and a warning sign again, would be loss of stamina. Sometimes loss of stamina could also be a sign that the pet could have low blood sugar. And again, sometimes loss of stamina or lethargy could be due to pain, that it hurts and they just don't want to be as active anymore. So again, loss of stamina could mean that we have anemia, low blood sugar, or pain associated with a type of cancer and would be considered a warning sign of cancer, something to help with early diagnosis. We think of lameness in certain patients as being a warning sign of cancer also. I think one of the things that I dread and fear most as a veterinarian is osteosarcoma. It's just a terrible, terrible type of cancer that affects a lot of breeds of dogs, especially the bigger ones. You know, we see it often in our Great Pyrenees. We'll see it in our St. Bernards. Again, a lot of our giant breed dogs like our Great Danes, but it doesn't necessarily have to be in those breeds. And if you look to the x-ray on the far right side, you can see in this bone, this is right above the dog's hock, you can see how that bone looks irregular, and it's thought of as being kind of a starburst appearance. And again, that's very, very painful for these guys. So some of the more common places for osteosarcoma to develop on the dogs would be above and below the knee on the back leg. And we also might see it close to the wrist, so down lower on the front leg, and also around the shoulder area. And if we have a patient who has a lameness that progresses, that doesn't seem to respond as well to our therapies, then we do worry about, could there be, you know, a form of cancer starting? And these are kind of interesting because, again, we want folks to watch closely to make sure that, you know, if you have a lameness that's progressing, that you get attention for it, that it might be something more than just osteoarthritis. Oftentimes when these patients come in, if I just touch the area, touch the bone, it'll feel warm. So if you ever touch a leg that's, you know, where you have a lameness and it feels hot to the touch, or again, you touch and there's really a profound soreness, again, have that checked in between your veterinary visits. And again, if you do have a lameness, the most important thing, if a lameness does develop, is rest your dog until you can get in to see your veterinarian. Difficulty in breathing is another sign of cancer. Now, average, we should see on a normal average dog breathing rate between 10 and 20 breaths per minute. And that's when they're not panting. So panting's okay. You know, dogs have to, you know, exchange their heat through panting, but this is values at rest. So again, if you were to count the breaths that your dog is taking per minute, we would expect their chest to rise and fall between 10 and 20 breaths per minute at rest. So if we have consistent values that might be greater than 40 breaths per minute, then it would start to catch my attention that maybe something's not quite right. And what I did is I put an example. This is the picture on the left is a Walker hound. His name was Woody, and he was quite young because he wasn't even 2 years old yet. And you can see when you look at the x-ray, it's really hard to see his heart. I put another x-ray to the right of his x-ray, and you can see the heart there. You can see the lungs, where the lungs are dark on the right side. They're dark means they're air-filled. But boy, you look at his x-ray on the left and you can't see his heart. That's because he's got fluid in his chest. And this is a patient where I actually took a fluid sample from Woody, and we found out that he had lymphoma. So it's unfortunate that younger dogs too can sometimes struggle with bad cancers. It's not always just with our dogs with gray muzzles. So again, pay attention at early warning sign of any kind of difficulty in breathing. Difficulty in urinating is also another sign of cancer. And unfortunately, we have some breeds that are a little bit prone to having certain kinds of bladder cancer. One kind of bladder cancer that's quite common is called transitional cell carcinoma. And our little Scotties, they're prone to it. We also have some predilection in our little Westies too. But again, we worry about if dogs are having difficulty in urinating. That might mean that when they go to urinate that they don't produce urine, that it's not coming out, or maybe it dribbles out with straining, or maybe there's an intermittent spurts to the stream of urine coming out. Oftentimes, and this is what I usually see, is oftentimes dogs present to me with having had recurrent urinary tract infections. So again, a recurrent urinary tract infection that's not very responsive to medical support certainly would be a red flag that maybe we need to start looking for something that could be more serious, like possibly bladder cancer. And I have over on the right-hand side, this is Cindy Higginbotham, and she actually has 8 Westies. So can you imagine that household? I bet there's never a dull moment. We also worry about difficulty in having bowel movements. This is a patient that has a mass back by his rectum, and that kind of impinges upon his ability to have a bowel movement. So, I mean, this is pretty obvious that there's a problem there. But at one time, this started out small. So again, we always want to look, really closely at our patients to make sure that we don't see anything around the rectum that's starting. So if they have difficulty defecating, like straining, or again, we talked about blood, passing blood, if there's a consistency change to the stools or a diameter change in the stools. Again, a change in the diameter might tell us that there could be a growth in the rectum or a polyp that is making that size and shape a little bit different. So when we're doing our in-between veterinary visits checks, again, you want to go from the tip of the tail all the way to the tip of the nose doing your examination, not to forget to look around the rectum. Oftentimes these bumps back there, if they're visible on the outside, might start as small as a pea, and that's when we want to catch these things. So again, always be watching back there. We have difficulty eating. Again, we think about when we have difficulty eating, I'm going to skip ahead there, that maybe there's something making it difficult to eat. This is a patient, her name was Daisy. You can see on the picture by the yellow arrow that there is a mass back there. It's a red mass. This actually turned out to be pretty good because it was a polyp. This was kind of an incidental finding with her dentistry. She was actually having dentistry done because she was going to go have her cataracts removed, and the ophthalmologist wanted her to have good dental hygiene before they did anything like that. So this was back there, and then on further investigation, she was having a little bit of trouble swallowing because this was getting in the way. So again, if we have difficulty eating, swallowing, or coughing, we may actually have something growing in the mouth that doesn't belong there. So at home, to do a complete oral exam, it would be important that you take and you lift up on the lips and look, under those lip folds. You want to take advantage, and when your dog yawns, you want to look underneath the tongue. You want to look at the roof of the mouth. You want to try to look on the inside of the teeth. If you can, look back at the tonsils. And this is sometimes best done with dogs that don't want to be handled around their mouth, just when they're when they're laying down, when they're panting. If a dog lays on their back, sometimes their lips will fold out, and so take advantage and be looking for things. Discolorations of the gum surface, raised areas that aren't symmetrical. You can always compare right to left to see if the right side compares to the left. So again, anytime there might be something that changes in between your veterinary visits, make sure you go in and have that checked. This is Max, and well, was Max. Max has gone on to heaven. What you see there on the left, that is a melanoma that was blocking almost the entire back of his throat. And we ended up going in, and he had odor and blood coming from his mouth. And he was an older individual. He was actually 12 years old, and he had been in a cart, a wheelchair, for about 5 years. He had paralysis, and when he came in for dental care, we found this mass way far back in his throat. We were able to go ahead and remove it on the right. And again, we knew that this wasn't good because it's very, very angry looking. You can just tell that by looking at it. But we were able to take our surgical laser and go ahead and remove it. I suspected it was a melanoma. Of course, that's not a good diagnosis for Max. But we were able to improve his quality of life by doing a palliative surgery. We got him on some herbal formulas, and he was able to go on and have good quality of life for about 5 months. And of course, if this hadn't been tended to, this would have been very life-limiting, very, very fast. I also added on to our signs of cancer about behavior changes and seizures. So I think about when we have a behavior change or seizures, it makes me think about in our older patients that perhaps we have the start of a change in the brain, and oftentimes it could result in a brain tumor. So things that I watch for with my patients and have my clients look for at home would be an out of character behavior in our older patients. Pacing, almost like an obsessive compulsive pacing where they can't stop walking, could be a sign that we could have a tumor. Of course, that's also a sign of cognitive decline or dementia, which is a whole nother topic and challenge with our older patients. Head pressing is another sign that they can do. They'll walk up and just kind of lean their head into things. Again, we talked a little bit about different types of obsessive behaviors. And one of the things, if you look closely, and not all patients that have a brain tumor have this, but unequal pupil size could be a red flag that we have problems. This little dog here, his name was Smitty, and owner is Chad. This was Christmas time several years ago, but we just lost Smitty last weekend to a brain tumor. He had a seizure and actually didn't survive that. He passed away at home in his owner's arms. So again, we really miss him. He was a special little fella. He actually also had Cushing's disease, but he was about, we guess, about 12 years old. So if we get a diagnosis of cancer, which none of us want to hear that word, but when we look at the incidence and we know that 50% of dogs can get cancer if they're over the age of 10, and 1 in 4 might get cancer, then we need to start somewhere. And I think it's really important to set goals. And our goals are going to be different based on, of course, our personal philosophy of medical care and also maybe our pet's needs. I have a contrast here of patients. On the left, this was Luke. He was a beagle, and he came in. He had a lot of different problems going on. You can see him there. He's getting his acupuncture treatment. He just comes in. He would flop down on the floor, and he would just wait for us to do whatever we needed. But on the right, we have Toby, and Toby was an older Jack Russell Terrier. He was just a mess, you know. Even though we create a fear-free environment in our hospital, he did not want to come see us. He would shake, he would pant. He was just not a happy camper, no matter how we tried to calm him. And so again, his needs might be and your choices for a patient like him might be different than Luke, who doesn't care where he goes. He loves everybody. But again, we want to kind of keep in mind that if Toby would have needed to be hospitalized, that wouldn't have been a good emotional quality of life for him. And Luke, he wouldn't have cared as long as somebody was paying attention to him. So again, sometimes we have to set our goals based on how our pets respond to being out of the house and being in hospital situations. So we definitely want to explore, our options and definitely want to provide a personalized plan for pets that have cancer. Again, just to kind of reiterate that sometimes our decisions and our philosophy can be affected by our past experiences, not only with our pets, but even family members. This is a patient, his name was Finley. You can see he has a large mass hanging down from his abdomen. And Finley's family had another patient or another pet, another dog who had a tumor removed from the abdomen on the skin, and the outcome wasn't a good one. She did not have a good recovery, and it did not extend her life expectancy. So again, that affected their decision making for Finley. They chose not to intervene with a surgical intervention when this was smaller, because again, they were fearful that the same thing would happen to Finley that happened to the other dog, which is certainly understandable. But if we look at what options we have for our pets, we would certainly hope that we could get a cure. And that's where early detection and diagnosis comes in, because if we find a lump or bump or a cancer in its earliest stages, it certainly gives us more options to tend to it. If we find a mammary tumor on a dog that's the size of a BB or the size of a pea, then sometimes a surgical intervention could be curative. Or if we find a mast cell tumor that's tiny, again, sometimes surgery can be curative. We may choose as a personalized plan just to support a remission of cancer. We may choose to slow the progression of a cancer, maybe just to maintain quality of life. So we see what Mother Nature is going to do, and we just help our pets, deal with any side effects that crop up because of that. And we might decide to do all of the above, or maybe none of the above, depending on that pet's needs and personality. The needs for Finley changed because they made a little sling for him so he could wear it around his mass and up over his back. So they had to do some special nursing care. They had to be careful with Finley to make sure that lump there hanging down didn't get any abrasions. So again, that's one way they were able to maintain his quality of life. If we look at how we approach cancer, it's always best to approach a lot of different disease processes from an integrative standpoint. So what that means is we want to not only consider using conventional care, but we want to use good nutrition, we want to provide good physical medicine, we want to maybe make some behavioral changes too, because we want to maintain good emotional quality of life for pets that maybe, can't go out on their walks anymore or have to be in the house more. So there are some ways we can use food puzzles and ways we can interact with our pets to help provide emotional quality of life. And of course, we have a lot of alternative options. TCVM stands for Traditional Chinese Veterinary Medicine. So if we just do a quick overview again of our conventional therapies, we have surgery, and surgery might be curative or it might be palliative. We think back about the mass with Max, the big mass in the back of the throat. That was definitely a palliative surgery because we knew we couldn't get enough to cause a cure. We have chemotherapy. We have electrochemotherapy where the chemotherapy is actually targeted into the tumor. We have vaccines that can help with melanomas. We have radiation therapies, and the bisphosphonates are one way to help manage bone pain. Metronomic chemotherapy is the use of low doses of chemotherapy to avoid side effects that can be used more frequently. So again, our goal is to really reduce the dose so we don't have the side effects associated with conventional chemotherapy, but we know we're just kind of palliating, that we want to, maybe make that tumor a little bit smaller. We have anti-angiogenesis therapy. That's a fancy name for trying to cut down on the blood supply that's feeding that tumor. And we do have different drugs that can do that. Even the antibiotic doxycycline can make a difference with sometimes the blood supply. We have some conventional drugs like the tyrosine kinase inhibitors that can help with that. We also have some herbal formulas. And again, I'm going to do a quick overview because we just don't have a lot of time to dwell on these in detail. We have immunotherapy that can be used, and again, that's the use of a vaccine to help. They did this study at the University of Pennsylvania. Unfortunately, I don't think they're continuing with this study because there have been some complications associated with that. Our integrative therapies might include traditional Chinese veterinary medicine, where we do acupuncture. Tui Na is a fancy name for Chinese massage. We have herbal formulas. We have special kind of food therapy. Qigong is really important because that's taking care of ourselves. So that's how we support ourselves so we can support our pets a little bit better with our cancers. We have mushrooms, we have homeopathy, different supplements, ozone or oxygen therapy can sometimes help these patients. And also we have energy medicine like Reiki and different types of massage that can be helpful. So acupuncture, again, I'm not going to spend a lot of time on that, but that's one of my favorite tools to use because it is non-invasive and it doesn't have very low risk of side effects, and most pets tolerate it really well. And our goal when we use acupuncture with our patients is to decrease pain. Sometimes that helps treat conditions where other processes have failed. And one of our goals is to actually speed recovery time from an injury or an illness. One of the things I like best about it is it does help mitigate some of the clinical signs associated with cancer, like pain or vomiting and diarrhea, seizures, paralysis, cough, and urinary incontinence. Here's a regular patient of mine. His name's Brody, and he really likes to come in and have his acupuncture done. We have non-pharmaceutical anti-inflammatory devices that can help our cancer patients with their pain and inflammation. This is an example of I'll go back here, an anesthesia loop, and basically we put it over the area that hurts. If we look at how it works, this is kind of the chemical formula. We don't need to worry about that other than it does help with our growth factors and some and a cascade of events there. But what's nice is this is one of the few things that can be used with cancer. Some of our modalities like laser therapy and other things we don't like to use with cancer, but this device has actually been used in human studies in reconstructive surgery. So the FDA has reviewed it and said that it does not carry a contraindication for treating cancer sites. So if we have an area of pain, we can certainly use this over that area of pain. We just kind of keep it away from a tumor type called hemangiosarcoma, though, just to stay on the safe side. But again, one tool that we have that we can use at home to help these patients feel a little bit better. And again, there's just another loop there. And the dietary supplements, again, I just want to list them so you know that they're out there, so you can ask your veterinarian about them if the need rises. We have probiotics that modulate our gut microbiome. Vitamin D3 is low in a lot of cancer types, so there's actually a blood test can be done to show if you need to be supplemented with vitamin D3. We have IV vitamin C that can be used to help support cancer patients. Our omega fatty acids are good because they inhibit pro-inflammatory mediators. We have some herbal formulas to help with cancer patients, and I mentioned some of these when I talked about Dolly, our nosebleed dog. And herbal formulas, they have a combination of different herbs in them, and again, we're not going to dwell on these because we're running out of time, but I just kind of wanted to flash these all up here to let you know that they are available to help support cancer patients. And again, just more of a list of some of the herbal formulas that's used for different side effects of cancers. I have an herbal formula that's so good for, you know, loss of appetite called 8 Gentlemen that we reach for often. And they're actually herbal formulas that help treat different types of cancer. Like breast cancer, we use a breast stasis formula. So again, something to inquire with your veterinarian about if you have a pet that has cancer. We have immunotherapy. Again, we think about mushrooms, more mushrooms and more mushrooms that have really good effect with slowing the progression of certain cancers. And last but not least, we have our endocannabinoids. I will reach for these for patients that have appetite problems or pain problems, in addition to using other support. Just want to end with just a short segment on palliative surgery. And this is, again, we don't expect to have cure, but I wanted to share just a few cases and then we'll get to our questions. This was a kitty cat patient that I just wanted to share with you folks. This kitty had metastatic breast cancer, and you can see on the left, this was just a nasty, angry tumor, and this had a lot of odor, and her folks brought her in for euthanasia. We talked about some of the benefits of just having a palliative surgery, not anything aggressive, but she went on to have a good quality life and great recovery from surgery. She lived comfortably for over 9 months. This is Tootsie. She had a mass on her muzzle that when she touched things, it would bleed, and she was brought in for euthanasia. We talked about how we weren't expecting curative care because this looked like a really angry tumor, which it was because it was squamous cell carcinoma. We took her to surgery, we removed it, and post-operatively, she had a great recovery. She went on to have a good quality of life for 4 more months, great quality of life. Another palliative surgery, this patient lived for 3 years. We would have to go ahead and debulk this mass here, but we were able to, again, maintain quality of life after each surgery, and Precious had a great life for 3 years. It's another big one. Again, dog presented for euthanasia, huge tumor hanging off the back leg. You can see the part of the surgical process there, the end surgery on the right side, and there's our happy boy, Sammy. So again, he went on to have a good quality of life for over a year, and then he succumbed to other things. So just again, some examples of palliative surgery, not meant to be curative, but to help to maintain quality of life where otherwise it wouldn't be. Again, Brogan, the last one I'm going to talk about, really worried about him because he had a really, really large mass in his abdomen. It weighed 27 pounds. There it is. That turned out to be benign. And he went on and lived for 9 months before he was euthanized for other age-related changes. We have some foods that we can look at. Colorful foods are always really good for cancer patients. So we want to look at, liver, beef, blueberries, things that are, again, colorful. We want to avoid damp foods like milk and cheese, but apples, almonds, walnuts, and seaweed can be helpful for our cancer patients. And a great reference that talks even more detail about different cancers in our older population is Dr. Alice Villalobos's book, Canine and Feline Geriatric Oncology. So I'm going to end with that and see if we have some questions that I can answer, if I can figure out how to access the questions.
Thank you so much. That was really helpful and interesting, and I know I learned a lot. Thank you so much, Dr. Shearer.
Oh, you are welcome.
Yeah. I am not seeing any questions in the question box right now, but I would encourage our participants, if they have any, to type them in, and we can relay them to you.
Okay. I was just going to say, you know, while we wait for questions, you know, if somebody thinks of something after this lecture, you know, please email me. The other thing is, again, I can't tell you how important it is to, you know, do these self-checks with your pets at least once a month, and go from, you know, tail to nose, nose to tail. Look inside the lips, look up the nostrils. You know, one thing I didn't mention is, you know, even take and roll the eyelids up a little bit. Look at your eyes, look at the third eyelid. You know, put your hands on the body and, you know, feel for lumps and bumps, and really, really focus, because again, early detection is so important.
Yes, I couldn't agree more, and it was great to hear some of the stories of the animals that you had been able to help because people were being vigilant.
Oh, go ahead.
We just did have a question come in from Amanda, who asks, what about distal stasis in the middle palace for pancreatic cancer? My dog has pancreatic carcinoma and was given 5 days to live. That was 3 months ago almost. She is on, I don't know how to say it, Zhao Chai Hu Tang.
Okay.
And the Liu Zun one also, and mushrooms.
Okay. Well, pancreatic cancer in dogs is kind of a scary thing. I think the thing that I see most often with it is it sometimes results in low blood sugar. So I'm not sure if this dog is experiencing problems with that, but the herbal formulas do help improve quality of life. And again, nutritional therapy might also be helpful. So, you know, the mushrooms are good because they have some antioxidant and anti-cancer properties. The herbal formulas work in different ways to help support cancer patients and the immune system. So again, what I would think that would also be beneficial if we're looking at alternative care, because again, pancreatic cancer is kind of difficult to treat with chemotherapies in our pets, would be to consider, again, talking to your veterinarian about specific food therapies, and also acupuncture, or if your dog's not comfortable going into a veterinary hospital, if it makes them nervous, then the other thing to do would be to learn some acupressure. And so there are some points that can help with cancer and digestion and the immune system.
Great.
Ooh, now I see lots of questions.
Yes.
I just don't know what they are. We might not get to them all. If we don't, like I said, please email me and I will work on them in the next 2 days.
Yeah. Yeah, some of them are a little specific. So I'm thinking maybe some of them would be best handled directly. We did have one gentleman ask about a dog licking their paws. Okay. And I don't know if there's anything you might speak to in that regard.
Yeah, well, if it's, I guess it would make a difference if it's one paw or all paws. And are the paws angry and red, or are they, you know, do they look normal? So whenever I have a patient who licks their feet in general, you know, I do worry about allergies causing them to lick. Or in the older patients, I also worry about pain. You know, could there be arthritis in those toes that, excuse me, could be hurting, and so they're licking their feet because of pain. So that might be, again, an important topic to bring up with your veterinarian, or again, if you want to email me with a little more details. But I think about allergies, I think about pain, especially if there aren't any, you know, specific sores there on the feet.
Okay. And we have one request for the reference to Dr. Villalobos's book again, but just to let everybody know, we will be emailing you the link to this webinar, and I think you've just put up the, there we go. There's the cover of the book. But we will also be emailing the link to this recorded webinar to everyone so you can go through it again. And there was so much good information that I think it'll be helpful to be able to process it in slow motion.
Yeah, sorry it had to be so rushed, but there was just so much I wanted to share and not enough time to get it all out there. So again, please review it, and if there's something you want to know a little more detail on, let me know.
Well, we really appreciate it, and we hope that perhaps you'll come back again and share some of the other information that, and I'm sure there's a lot of other information that you weren't able to fit into this session. So thank you so much. We really appreciate your time and your wisdom, and obviously your compassion and heart for all animals, but particularly for senior dogs. So
you are very welcome. Thank you for the invitation.
All right. Well, thank you, and thank you for all of you who joined us today. Again, we'll be emailing you the link to the recorded webinar. Take care of everybody and stay safe. Bye-bye.
Bye. Thank you.